Assalamu alaikum everyone, I hope you're all having an amazing day. My name is Dr. Muhammad and I'm really glad that you're here in today's video because in today's video we're gonna talk about interstitial lung diseases. All of the high yield stuff, all of the important information that you need to know about interstitial lung diseases for your exams. So in today's video we're gonna go through the pathology and the types of interstitial lung disease, how it presents in a typical patient, the best investigations, and what you need to know in terms of the management of ILD. So before we get into today's video, just a disclaimer is that this video is intended for educational purposes only and it's not medical advice. So without further ado, let's get right into today's video. What is interstitial lung disease? So interstitial lung disease is a group of conditions that fall under restrictive lung diseases. So what are restrictive lung diseases? So restrictive lung diseases are conditions that affect the expansion of the lungs. And because of the fact that the expansion of the lung is affected, this is going to affect the gas exchange process that occurs within the lung at the level of the alveoli, potentially leading to hypoxia. And remember, if there's impaired oxygenation, there's going to be increased vasoconstriction in the pulmonary circulation, which can lead to pulmonary hypertension, and this can affect the right side of the heart, leading to right ventricular hypertrophy. So overall, this condition is known as cor pulmonale. So again, in restrictive lung diseases, the expansion of the lung is affected. So there are a number of types of restrictive lung diseases. So for example, if there are issues that are associated with the pleura, such as a pleural effusion, this can affect the expansion of the lung. So imagine the buildup of fluid that occurs within the pleural space. So how is that going to affect the expansion of the lung? So the lung is going to have issues with expanding, leading to issues with gas exchange. So next, so we've got neuromuscular disorders, so conditions that can affect the nerves and muscles associated with the lungs, which can lead to issues with the lungs expanding. And such conditions include things such as myasthenia gravis and ALS. So we're not going to dive deep into each of these conditions. We're going to make a separate video for each of these conditions in the future. So these conditions are beyond the scope of today's video. So next is we've got thoracic wall disorders. So what happens if the thoracic wall is affected? What is that going to do to the expansion of the lungs? So exactly the same thing. And conditions that affect the thoracic wall include things such as hyposcoliosis, obesity, and ankylosing spondylitis. And finally, we've got interstitial lung diseases. And this is the thing that we're going to focus on in today's video. So what are interstitial lung diseases? So interstitial lung diseases is basically an umbrella term that is given to a group of diseases that lead to scarring and fibrosis within the interstitium. So before we talk about the interstitium, what are the functional units of the lungs? So one functional unit of the lung is the alveoli. So we've got so many alveoli, and the area in between the alveoli is known as the interstitium. So in ILD, the interstitial space or interstitium is the area or part of the lung that is affected. So what happens if there's fibrosis or scarring within the interstitial space? This is going to, number one, lead to reduced lung compliance because the lungs will have issues changing in volume. And if the lungs has issues changing in volume, it's going to affect the pressure gradient from a higher concentration to a lower concentration, which can impair gas exchange. So what are the causes of ILD? So the causes of ILD can be broken down into 4 categories. So the first category is going to be exposure related. So some people may be exposed to certain chemicals in the environment or in their occupation for a long period of time, which can damage their lungs over time. So such chemicals can include things such as coal, beryllium, and asbestos. Next is we've got systemic conditions. So remember, there are some autoimmune conditions or connective tissue diseases that are associated with interstitial lung diseases. So the conditions that you need to know for your exams include rheumatoid arthritis, sarcoidosis, SLE, and diffuse cutaneous systemic sclerosis. So make sure to have these conditions at the back of your mind, because in a typical patient who presents with interstitial lung disease, so when you come and take a history, when you come and examine these patients, it is very essential to bear in mind that they may have features of such conditions, these autoimmune or connective tissue disorders. Next, so we've got drugs. So the drugs that you need to know that are associated with ILD are amiodarone, bleomycin, sulfasalazine, and busulfan. Next is we've got idiopathic pulmonary fibrosis, and this is the most common type of ILD. So most cases of idiopathic pulmonary fibrosis are sporadic. However, studies have shown that there is a genetic component to it. So we've talked about a number of causes of interstitial lung diseases. However, some of these causes can affect the upper parts of the lungs, while the other causes can affect the bottom part of the lungs. So this is something that examiners love asking about, so make sure to learn this. So what are the causes of upper zone fibrosis? So make sure to remember the mnemonic charts. So C is for co-workers pneumoconiosis, H is for histiocytosis or hypersensitivity pneumonitis, A is for ankylosing spondylitis, R is for radiation due to, for example, treatment for breast cancer, T is for tuberculosis, S is for silicosis or sarcoidosis. So make sure to learn this. So if we've got causes of upper zone fibrosis, then we've also got causes of lower zone fibrosis. So you can remember this by the mnemonic I don't care and then A. So there's a mistake here in the spelling, but remember, I is for idiopathic pulmonary fibrosis, D is for drugs. So we've mentioned the drugs, amiodarone, bleomycin, sulfasalazine, busulfan. C is for connective tissue diseases, and A is for asbestosis. So make sure to remember these causes. They're really important and they're really high yield. Now, how will a typical patient with ILD present? So in the history, make sure to remember the triad: exertional dyspnea, dry cough, and clubbing. And if you were to examine the patient, so they've got clubbing, you're able to see that, and on auscultation, you're going to hear fine end inspiratory crackles. So right towards the end of inhalation, you're able to hear these crackles. So fine end inspiratory crackles. And also you're able to pick up some systemic conditions. So make sure to familiarize yourself with the clinical features of rheumatoid arthritis, diffuse cutaneous systemic sclerosis, and sarcoidosis as well, because it's really important. And we're going to talk about these conditions in a future video. So now we've talked about how will a typical patient with ILD would present, and now let's talk about the investigations, the necessary investigations that need to be done. So now this is a very useful mnemonic to have at the back of your heads when it comes to the investigations of any condition. So remember, B, B, I. B is for bedside, the next B is for bloods, I is for imaging, and the final I is for invasive techniques. So now let's start with the bedside investigations. What should be done at the bedside? Remember, it is really important to take a thorough history as well as doing a physical exam. It is really important to assess the functional limitations of the patient, and you should also gather details associated with their occupation and whether they've been exposed to some environmental chemicals, because again, they're associated with ILD. Also, you need to ask about their medications, their past or current medications, and finally, their family history as well, because as we've mentioned, in conditions such as idiopathic pulmonary fibrosis, there is a genetic component to it. So again, you need to get the vital signs, do an ECG. We've mentioned that if there's a condition that is associated with the lung, where the lung has issues with the gas exchange process, this is going to potentially lead to hypoxia. And if there's reduced oxygen in the pulmonary circulation, this can lead to vasoconstriction of the pulmonary vasculature, leading to pulmonary hypertension. And this can affect the right side of the heart, leading to right ventricular hypertrophy. And this can be picked up by an ECG. And also, pulmonary function tests need to be done, and these include spirometry, where you're going to see a restrictive pattern, and also a diffusing capacity of the lungs for carbon monoxide needs to be done, where there's going to be reduced carbon monoxide gas transfer. So next is we've got bloods. What kind of bloods do we need to do? Routine bloods. So what can be detected on a full blood count? So because of inflammation, because ILD can be associated with inflammatory conditions, such as systemic conditions, connective tissue diseases, where there's inflammation, there can be a specific type of anemia called anemia of chronic disease. If a patient has SLE, systemic lupus erythematosus, it may be associated with lymphopenia. Usinase, LFTs will also need to be done. Markers of inflammation will also need to be measured, such as CRP, C-reactive protein, and the ESR as well. And finally, an autoimmune screen needs to be done in order to help rule out autoimmune conditions such as rheumatoid arthritis, systemic sclerosis, and SLE. Next is we've got imaging. So what kind of imaging should be done? So the initial imaging modality that needs to be done is a chest x-ray. And what is typically seen on the chest x-ray are fine reticular opacities. And these are due to the fibrosis in the interstitium. However, the best imaging modality for interstitial lung diseases has to be a high-resolution CT scan, where there's going to be honeycombing. And what is honeycombing? It's basically destroyed and fibrotic lung tissue that has cystic air spaces with thick fibrous walls. So we're going to see honeycombing as well as traction bronchiectasis as well. So traction bronchiectasis is basically dilated airways. The initial imaging modality is a chest x-ray, but the best imaging modality is a high-resolution CT scan. So invasive techniques are considered if the previous investigations are inconclusive. So I'm not going to get deep into the invasive techniques, but just to bear in mind, there are two invasive techniques that are considered, such as bronchoalveolar lavage and a lung biopsy. So these are the investigations that are considered for patients who are presenting with typical features of ILD. So now let's talk about the management. What you need to know in terms of the management for patients with ILD. So the management of ILD can be broken down into three categories. So the first category is going to be conservative management, and then medical management, and finally surgical. So conservative management is all about doing things such as avoiding the triggers, pulmonary rehabilitation, providing supplemental oxygen, and vaccinations as well. Next is we've got medical management. So to manage a condition medically, it's all about treating the underlying cause. In cases of IPF or idiopathic pulmonary fibrosis, then there are two medications that are proven to reduce the progression of the disease, and these are pirfenidone and nintedanib. And while for sarcoidosis, corticosteroids may be beneficial. So for surgical management, a lung transplant is the only option that is able to reverse the physiological function of the lungs. So remember, conservative treatment, medical management, and finally surgical management. So we've talked about the pathology of ILD, we've talked about the causes, how it typically presents, the investigations, and finally what you needed to know in terms of the treatment of ILD. I really hope you enjoyed today's video. I really hope you found it informative. If you did, please leave a like and subscribe for more videos like this, and I'll see you next time.